Hello friends, it's nice to be with you once again. It's been a while and I've been away for some time, but I missed every single one of you and I noticed that you were still there for me. Thank you for being there. While I was away, one of the things that happened is that my children took turns with chicken pox. Yes, it was quite stressful, and I thought to share with you some simple things I did to manage the chicken pox at home. Yes, you heard me right, at home. Chickenpox is a highly contagious viral disease that is more rampant during hot weather. And it is spread by contact with a person who has it. And after such contact, within 14 to 21 days, the person begins to show symptoms. The person might begin to have rashes on the face, neck, the back, which finally spreads around the body. And these rashes are fluid-filled, itchy rashes that make the person feel really uncomfortable. Some might come down with a fever after the rashes have appeared. Some feel generally unwell, tired, and some even lose appetite. In this video, we will be talking about 5 simple things you can do to manage chickenpox at home. Some might say, yes, just go and use Ampiclox and it will dry up the blisters. In this video, we'll also be talking about why Ampiclox or any other antibiotic is not the right answer. So sit back and let's dive right in. If you have not subscribed to this channel, please do that now. So the first thing we need to do is keep the child at home, and if it's an adult, stay at home until the blisters have dried up and have become scabs. That way you are unable to infect other people, or the child is unable to infect other children like classmates and playmates. To relieve the fever that comes along with this viral disease, you can use paracetamol for the child. Not aspirin, not ibuprofen, but paracetamol. If the fever lasts more than 4 days, please take the child to the hospital. If the temperature is above 39 degrees, if it is from 39 degrees and above, please take the child to the hospital. Do not manage that at home. The third thing we need to do is to manage the itchiness that comes with chickenpox. You can give Piriton by mouth. You can apply calamine lotion on the skin because it is cool and soothing, so it will help with the itchiness. We can as well cut the nails short so that the child or even the adult is not scratching on those blisters. Scratching can make it worse. It can even get the blisters infected, and that could lead to more complications. Never apply antibiotic creams like corticosteroid creams, triple action creams. Never use them on those rashes. And never use any product that contains fragrance or perfumes on it. All these can irritate the skin even more and cause complications. Another thing to be careful about is that scratching can leave indelible scars behind. The fourth thing we need to do is hydrate well. Drink lots of water to help the body get rid of the virus. We can also supplement with vitamin C, zinc, garlic, and any other thing that boosts our immune system, because at this point, the fight belongs to the body. So what you might notice is that within 3 to 7 days, the chickenpox is gone. The fifth and the last thing we should do is never use antibiotics to treat chickenpox. Some persons believe that the antibiotics like Ampiclox can help to make the blisters dry up and form scabs, and those scabs will finally fall off. But this process is actually a natural process that happens on its own. Antibiotics are designed to treat infections that are caused by bacteria, not infections caused by viruses. So it's simply a misuse of antibiotics when we do that. Formation of that hard crust, that brown crusty substance on the wound, is a natural process and is part of a wound healing process. You may remember the last time you had a wound. You didn't need to take antibiotics before the wound or the bruise healed and those brown crusts formed on it and later fell off. It is just a natural process. That's the way it is with those rashes or those wounds you see caused by chickenpox. They heal on their own. So all you just need to do is strengthen your immune system and let your body do the job. There are a few things I would like you to note about managing chickenpox at home. There are times when you should never try to manage chickenpox at home. For example, if the immune system has been lowered by some other infection like HIV, or the person just had a recent transplant or is on cancer chemotherapy, if the child is less than a year old, or if the blisters are red, swollen, and oozing with pus, it's actually a sign of something more serious, or possibly an infection of the blisters that would need medical attention. What if the child begins to feel very tired, can't walk, has severe abdominal pain, or develops stiff neck? These are signs that better medical attention is required, and this should not be managed at home. So finally, let's go over the 5 simple things I did to manage chickenpox at home. 1. Stay at home or keep the child at home. 2. Stay hydrated. Drink lots of water. 3. Manage the fever. 4. Stop the itch or manage the itch. Calm it down. And then 5. Never use antibiotics. Till I see you in my next video, continue to stay safe and stay healthy. I remain Grace Obunaya, your pharmacist and health coach. Bye.